and timed. Okay. Now, USCE, or the US clinical experience, United States clinical experience. Now, the basic aim of USCE is to get a US physician letter of recommendation. Now, there are different forms of US clinical experience. Electives. Now, electives are done in med school while you are in your medical college. The other form of US clinical experience is the observership. In observership, you do not do any hand-on clinical experience. You do not get any hand-on clinical experience. It means that you are not examining the patients on your own. You are just observing the physician or you're attending, but you are not doing any kind of active patient management or handling. It is done after you have graduated from your med school. The third US clinical experience is the research. Now, the university hospitals prefer if you have done research, because once you are going to a university program, you are probably going there because you want to do fellowship. So for getting into a fellowship, you should have a good research background. The other form of US clinical experience is the externship. It's a hand-on clinical experience. You are actively involved in patient management. You are not just observing, you're attending a physician, you are actually examining and treating the patient. It is also done after graduation, but it's very hard to get into externship in USA, because it's very difficult for a physician to let you handle his patients. Now, electives or externship is better than research, which is better than observership. So observership is the least favorable kind of US clinical experience. It's very difficult to decide which one is better, whether electives is better or the externship is better. And research is very important if you want to go into a university program. Now, US visa. You would require a visa to go to the USA if you are not a permanent resident of the USA. Now, there are B1 or the B2 visa, which is a visit visa. It is required for going for US clinical experience. If you want to get US clinical experience, like if you want to go for electives, observership, externship or research, you want to have a visit visa or B1, B2 visa. Even if you are going for your USMLE step 2 CS for step 3 or the match process and your interviews, you would require a visit visa if you are not a permanent resident of the USA or if you do not have a green card. Now, all of those who require a visa and are here in Pakistan, I would suggest that you apply for the visa, B1, B2 visa, after doing your step 1 and step 2 CK. Now, it takes at least 1 to a maximum of 6 months to have your visa back after you have applied to the embassy. But this time can be very variable. It can be less than 1 month or it can be even 2 years. Now, then is the work visa. J1 is a junior work visa. It is required if you want to do a paid residency in USA or if you want to get a paid research in USA. It takes 1 to 3 months on an average to get your US visa stamped for J1. The H1B, it's a higher form of work visa. It is also required for the residency or a paid research. It takes 1 to 3 months to get your H1B visa approved and stamped. Now, The benefit of H1B over the J1 visa is that it is said that H1B is never rejected by the embassy. Also, you cannot get a green card from a J1 visa. You have to do a J1 waiver for at least 3 years before you are eligible to have a green card or a permanent residence, while H1B does not have any kind of this waiver requirement. So H1B is preferred on J1 visa. But if you are on a J1, it increases your chances of getting a fellowship, because the university programs who are offering fellowship, they are very comfortable in sponsoring J1 rather than an H1 visa. So if you are on J1, it increases your chances of getting a J1 visa. It increases your chances of fellowship. Then if you are a US resident, you do not require any of these visas. And then there are spousal visas, the H4 visa, which is given to the spouse of an H1B holder, or a J2 visa, which is given to the spouse of a J1 holder visa. Thank you very much. Again, thanks for listening to me and going through all these USMLE slides. And once again, I would like to thank you very much for being and listening to me. Now, this presentation was brought to you by the MedPrep Medical Coaching Lahore. Once again, our contact number 0344430689. Please visit us at our website medprep.webs.com. Thank you very much.